Thank you, Art, and thank you to the organizers of this event. I think what this country desperately needs is hundreds of these all over the country. It's always a pleasure for me to be on a panel and in a day full of talks of people who really know what they're talking about. It's great. And people who know this industry, who know the issues so well. And what it makes so clear in my mind is the fact that what we're facing with healthcare today is pretty simple, right? You heard it today. The system is messed up, screwed up, too expensive, and so on because government intervention. And all the facts line up with this. There's no honest controversy here. And the solution is free markets. They work in computers. Why wouldn't they work in healthcare? And if you have any questions about the technicalities of how they work, these guys have the solution. This is easy stuff, you know. And not only that, just to add to that, the simple fact that our healthcare system is bankrupt. You know, Medicare and Medicaid, nobody's mentioned this yet. I'm an economist, I can say this. They're bankrupt. We cannot pay for them. There's no way you can pay for them. So by 2025, Medicare, Medicaid, Social Security, and it's primarily Medicare and Medicaid, and interest on the debt consume every dollar of revenue the federal government takes in. Every dollar of revenue. Most of that is Medicare and Medicaid. And those numbers are pretty optimistic. They assume government continues, you know, that the economy grows nicely, steadily at 3+% for the next 14 years. They assume that revenue is steady and constant and growing nicely. And these systems are bankrupt. So government involvement in healthcare is driving us into bankruptcy. It doesn't work. Quality goes down. You know, obviously, this system is crazy, and yet, what's the solution to it? More. Let's do more of this. You know, it's not bad enough. We need to pile on some more. And what happens to voices who say, no, there's a much easier, simpler, straightforward solution to this that actually increases quality, reduces costs, empowers individuals? There's not even a voice. Nobody's interested in even listening to that. So why? And you know, I know the number is 58% don't like Obamacare, but when you actually get down into the numbers, yeah, they don't like Obamacare, but they love Medicare and Medicaid. There's not 58% of Americans who don't want Medicare and Medicaid. They love those systems. And when you start actually digging and seeing what actually people like and don't like, the number of people who want free market in healthcare is minuscule. It's very, very small. And that's the number that's important at the end of the day. We need to repeal Obamacare, but what we need is an alternative to it, and the challenge is going to be to get enough people to accept that alternative. So what's going on? This should be easy. This shouldn't be hard. Freedom works. Free markets works. Government controls. Government spending. They don't work. And yet we want more and more of them. And my argument is that it's not about what works and what doesn't work. We won that argument a long time ago. Anybody who's an advocate for capitalism, we won the argument about free markets a long, long time ago. Doesn't help us one iota. We consistently move towards more and more government involvement in almost every field out there. So something else is going on. Something deeper is going on. Now I would argue that the problem is much more fundamental. The problem is not about economics. It's not about economics of healthcare. It's not even about politics. We get the politicians we deserve. It's about us. And it's about something deep down in us. It's about something essentially that we have bought into, that undercuts any attempt to move in the right direction with regard to healthcare. And that is the issue of morality, of ethics, of what we believe is right. Because in the battle between what works and what's right will always win. People want to be good. People want to be moral. They want to do what's right, even if it costs them a few cents. It's not pocketbook issues that determine elections and policies long term. It's moral issues. It's where people believe morality lies. And I would advocate that the left has the moral high ground. We have bought into their moral agenda. We might not have bought into all their details and all their policies, but we bought their moral agenda. And what is that agenda? That agenda says that need is a claim against all of us. That if somebody needs something, particularly if they need it, the perception is that they need it in order to live, then we have to provide it. And if we won't provide it voluntarily, then it's the job, it's the responsibility, it's the essential characteristic of government to have to come in and, as Art said, force us to provide that need. Because if you look a little bit differently at the history of government intervention in healthcare, need is everywhere. It was the poor and elderly people who needed better health care and tugged at our heartstrings that got us Medicare and Medicaid. Who could say no? People supposedly were not getting the best health care they could get. And therefore, at the end of the day, were dying before they should be dying, right? If they hadn't gotten the best. And how can anybody stand by and say, no, that's life, that's reality? They need it. It's our moral responsibility to give it to them. After all, what were we all taught when we were this little? What is the moral purpose of life? What is our moral responsibility in life? What does it mean to be a good person? To be a good person means to, I was brought up in a good Jewish family, and I was taught from when I was very young to think of others first, put your interests last, taking care of other people. That was the essential characteristic of morality. That's what my mother pounded it to be. Be selfless. And the ultimate virtue is to sacrifice. Sacrifice means what? It means giving up something and expecting what in return? Nothing. And the more you give up, the better, more moral person you are. Right? Bill Gates, when he makes his billions, is he a moral person? Is he a good person? Neutral to negative, right? But when he gives it away, is he a good person? Absolutely, he's wonderful. And you know what would guarantee sainthood to Bill Gates? Guaranteed. If he gave it all away and moved into a hut. If he could prove that he was suffering from pain. If he could prove that it was a true sacrifice. If he suffered for his fellow man, that would be virtue. That is our moral ideal. And we've almost all bought into this at some level or another. That is the moral ideal. That's what my mother taught me. She failed. And that's what your mother, I am sure, taught all of you. As long as we believe that, there are those children who don't quite qualify for Medicare, but their parents supposedly can't quite afford insurance, so we have to have something to fund them, and they're really not getting the kind of health care that is ideal. And how could you say no to children? I mean, nobody wants to say no to children, right? It's our moral responsibility. It's our moral duty. And who's on the other side of this?